Haley, thank you so much for spending a few minutes with us. I know that you just got off the night shift in the COVID unit. We've all seen the news stories. What is it like working in the COVID unit in the hospital?
There's a little anxiety, but we all want to be there because we are confident in our ability to care for these critically ill patients. And I know that they need me, so I'm accepting that risk and taking precautions to protect myself and my community.
And those precautions, you've been taught how to put on the proper protection equipment, correct?
Yes, and we have a dedicated nurse to help us take on and off our equipment every time we go in the room.
So somebody's always watching to make sure that it's being done correctly.
Yes.
Is it tense on the unit, or how do you keep each other uplifted?
With all the uncertainty around how bad it's going to get and where the protective gear is going to come from, it's hard not to feel the tension. But the nurses I've been working with, we do a good job of keeping it light in such a tense situation.
You are truly a team there, right?
Yes, absolutely.
Let's talk a little bit about technology. Most of the patients that you're caring for, if not all, cannot communicate right now because they may be on ventilators. So how are you keeping those patients, and maybe even more important, their families connected with those patients?
We have been able to receive voice recordings that families give us, and we can take those in and let the patients listen to them. And it gives them just an opportunity to send messages of hope and well wishes.
That's important for the family. Do you think that it's making a difference for the patients as well?
I hope so. It's hard to tell, but I do hope so.
Does it make a difference for you to be able to convey those messages?
It does. I feel like I'm doing some good for the family and giving them some reassurance so they can feel better while they're at home.
Can you give me an example without giving any sort of patient information of something that you might have done recently in terms of sharing technology?
I had a patient, the whole family sent voice messages, and I did. I took the phone and played them one at a time for the patient.
And how did that make you feel?
It was hard hearing them. I just had to stand in the room and cry, just feeling that unimaginable pain these families are suffering from. But I do feel like I gave a little reassurance to the family.
What would you tell families of patients who can't be there physically right now about how their loved ones are being cared for in the hospital?
Us nurses are putting ourselves in these families' shoes, and we are taking care of these patients as if they're our family, because that's what I would want a nurse to do. I can't imagine how stressful it is to be at home and be so helpless. So we have the best nurses staffing these units, and they're getting the best care they could.
And I know that it's stressful for you as well. How are you doing?
It is definitely emotionally and physically exhausting, but I'm taking it a day at a time, and I am thankful for the support from the community and from my hospital, and I just want that to keep going.
Thank you, Haley. On behalf of the patients, the families, our colleagues, the entire community, thank you so very much for everything you're doing every day. You truly are a healthcare hero.
Thank you.